Ahead of pre-Christmas week of industrial action, a senior minister has urged ministers to call off strikes. The government is readying 2,000 soldiers and civil servants to cover for ambulance and border force workers over the festive period, even though the head of the military has said it's not the correct use of his troops. Here's our political correspondent, Catherine Sampson.
After a week of walkouts, this winter of discontent only looks set to deepen. In the run-up to Christmas, troops are going to be drafted in to drive ambulances and cover for striking border force staff who are walking out in a row over pay. Ministers claim they're doing everything they can to keep people safe.
But ultimately, the only way we can get the service running as normal is for those strikes to be called off. And I would urge union leaders to give families a break this Christmas, to give the military a break this Christmas and to call off those strikes even at this late hour.
So your position on pay is not shifting?
So I think it would be irresponsible for us to allow pay to get out of control, which could have the effect on both on the public finances and on inflation.
So that sounds like you're not moving.
That's why the government will be reasonable but resolute.
On Tuesday, nurses in England, Wales and Northern Ireland are set to strike again. On Wednesday, thousands of ambulance staff in England and Wales are due to walk out, with more action planned 1 week later. Unions warn soldiers don't have sufficient training to cover for striking staff.
It's a sign of desperation. When a government is relying on the army to resolve an industrial dispute, that's desperate.
Instead of using all of their spare time in contingency planning and criticising health workers, they should be sitting down with health workers and their trade unions, doing their utmost to try and resolve this, because it is inevitable, sadly, that this will escalate.
There's no sign of any disputes wrapping up before Christmas. Next week, nurses could announce more strikes for the new year if movement on pay remains frozen.
So, Catherine, what everyone wants to know is what impact are these multiple strikes going to have on the health service?
Yeah, I think there are concerns for patient safety. Clearly, it's the middle of winter. It's a time when the health service is always under heavy pressure. Hospitals have been warned to prepare for extensive disruption. And yes, troops may keep things going with the ambulances in England, but the head of the armed forces has been saying, well, look, we're not an emergency service of last resort. It's hard to see how this all resolves, though, when basically ministers say we want to talk, but they don't want to talk about what unions do, pay.
OK, Catherine, thank you very much indeed.